So I recently graduated from Northwestern University. I studied cultural anthropology and global health there. And in the summer between my sophomore year and my junior year, I volunteered on a medical brigade to provide eye services to patients in Peru, in Arequipa, Peru. We worked with a hospital there to set up an operating room. There were a lot of patients that had bad cataracts or a lot of sun damage that required surgical procedures, so most of the physicians and nurses that were part of the team spent their time in the operating room, but I spent my time at the clinic, which was set up at a nearby school. We used the gym and the basketball court outside to set up different stations to provide standard eye exams, gave out glasses. There were some doctors there who were also able to do minor laser procedures that were needed. I was working at the station to test the distance vision of all the patients that came through the clinic.
A couple of days into the trip, we were walking around the town in Arequipa, and a little girl comes up to me and she tugged at my hand. She had these really big, thick glasses on, and she was asking me about a particular doctor, so I brought her to him, and he was really excited to see her, really happy, and she was so happy to see him. They hugged, and he took off her glasses to examine her eyes.
And when she had her glasses off, I realized that she was really cross-eyed. And later that day, when I asked the doctor about the girl that we saw in town, he told me that she was one of the patients that he saw the previous year when he volunteered on the same medical brigade. This particular organization that we were working with was only set up to provide healthcare through these temporary 2-week clinics. And for whatever reason, she couldn't afford the surgery to correct her crossed eyes. So she just had to wait until the free clinic came back into town. And that moment really stood out to me for a couple of reasons. For one, I was just shocked that she had to wait so long to get her surgery for a condition that was so easily treatable, relying on one particular doctor who was volunteering with one particular organization. So on the one hand, I remember being glad that the girl was able to be treated now because she was eventually able to get her surgery that year. But more than anything, I remember just thinking it's absurd that she had to wait so long in the first place when she needed and deserved the surgery much, much sooner. And for the rest of the trip, I found myself wishing that I could just be in the position of the doctors and the nurses there, the people who were actually able to provide the health care and to make the biggest impact on the community that we were serving. So that's my story. I added the Margaret Mead quote at the end because, one, I think it's true, and two, I think it's particularly fitting when discussing the sort of humanitarian work that Timmy Global Health provides. I've been involved in all sorts of volunteer trips, community service trips, service learning trips, and it's something I'm very passionate about, something I think is very important. So I would love to be able to maintain a blog that projects the perspective of an international volunteer while also hopefully fostering discussion about the role that medical brigades play in providing more comprehensive and long-term healthcare solutions to where they're needed the most. So thank you for your votes, and thank you.